Must be February, March South the Cardiology Guide. Every February, American Heart Month affords the cardiology community the opportunity to promote cardiovascular health. I want you to think of your heart as your house. You have the plumbing, which is the arteries and the heart valves, the structure, which is the muscle, and the electrical system of your heart. Before we proceed, I thought it'd be important to talk about some of the risk factors for coronary heart disease. The most important risk factor for cardiovascular disease is age. As we age, cardiovascular disease becomes more prominent. Family history. I bring this up because 90% of cardiovascular disease is avoidable. Smoking, which is a huge risk factor. High blood pressure, another huge risk factor for developing cardiovascular disease. Diabetes or metabolic syndrome, inflammation, obesity, toxins, and a sedentary lifestyle. One test that has become increasingly popular is the coronary artery calcium scan. Some of you guys in here have had that scan. Whereas calcium shows up on an X-ray white, where we assign the degree of calcium or whiteness in what we call a Gaston units. The more calcium or the more white that we see on the scan, the higher the Gaston units. The ideal score for a calcium score is 0. However, a score of 0 may be a little bit misleading in that the test does not show soft plaque, and so it has a 15% false negative score to it. Calcium itself is a protective mechanism, but the presence suggests an underlying cardiovascular process that indicates risk. Many older people do not develop chest pain. They develop shortness of breath and fatigue as a presenting sign for cardiovascular disease. So we place them on the treadmill. The nuclear stress test can be performed with medicine or on the treadmill. We don't have a bike. This is one test that we look at the plumbing and the electrical system of the heart. So we learn a lot from this test. How the test is performed, a lot of you guys in this room have had the nuclear stress test. You come to the nuclear lab, they start an IV, they give you an isotope, it's not contrast. They put you underneath the scanner. The scan takes about 15 minutes or so. And then you go and you see the exercise team, and you get either a drug for the stress or they put you on the treadmill. And it's important to know if you do choose the treadmill portion of the test, that you're in control of the test at all times. No one's going to push you any harder than you want to be. And then you tell the team when you're completed, they give you the isotope again, and then we compare the resting images to the exercise images. And if you have blockages greater than 60 to 70%, that isotope's not going to get absorbed in that section of the heart. So it's a great test to rule out ischemic heart disease. We also are able to measure somebody's functional capacity or their ability to work. And then we also measure hemodynamic measurements such as heart rate response to activity, blood pressure response, EKG response, and whether they develop any symptoms or not. The development of symptoms on a stress test is actually the most positive predictor of a positive test. What should happen, we use something called the standard Bruce protocol when we do the stress test. So every 3 minutes, the speed and grade go up incrementally. And as the speed and grade go up, what we should see is we should see an incremental increase in heart rate and blood pressure. People that are deconditioned, severely deconditioned, we tend to see a more steep slope in their access. So their blood pressure will go from 120 over 80 to like 260 over 120 in like less than 3 minutes. The other test that is very important in the cardiology workup is an echocardiogram. You all seen pregnant women have little tests on the bit looking for the fetus. This is the same thing except we're looking for the heart. So we're looking at the size and shape of the heart. We're looking at the pressures in the heart. We're looking at how the heart squeezes in. We're looking how the heart relaxes, which is what we call diastole. And then in your heart, you have 4 heart valves. The purpose of a heart valve is to provide one-way blood flow throughout the heart. So it's going to tell us whether you're having a narrowing of that heart valve, or the heart valves are leaking, or the valves are prolapsing. And then we also are able to visualize the pipe that comes out the heart, which is known as the aorta. So we're looking at those, making sure that those are up to normal dimensions. The heart should be like a nice elastic rubber band. So as the heart fills with blood, it should be nice and compliant, and then it's going to expand whatever the blood pressure is and then eject. The way that you look at the left side of the heart is the main pumping chamber of the heart, and what it needs to pump against is your blood pressure. So if your blood pressure is high, then that left side of the heart has to work a little bit harder than normal. The way that you think about it is like if you came into the gym and you did curls all day long, that muscle would hypertrophy or get a little bit bigger. The problem with having high blood pressure is that when the heart gets a little bit thicker, it gets thicker from the outside in, and so the cavity gets a little bit smaller. Medication called Jardiance, which is known as an SGLT2 inhibitor. And these medications came out for diabetes about 10 or 12 years ago. But what we found out is that they're very potent heart failure meds. And are one of the meds that make the heart a little bit more compliable or a little softer as the blood enters in. The other nice feature about this drug is that it makes the body pee out about 300 calories per day. So what are some of the normal effects of aging on the heart? So everything that we've learned about the effects of aging on the heart, we've learned in the 1960s in the Complications of Bed Rest study. So there was a team down in Texas that put 5 college students in bed for three straight weeks. They wouldn't even let them get up to take a pee. They just kept them in bed for 3 straight weeks. And what they found out was there was a 30% reduction in their ability to do work in that 3-week period of time. But they also lost 10 pounds of muscle, and then they had a 10% reduction in the size and compliance of their heart during that 3-week period of time. So what was also pretty interesting is that in 30 years, they brought these same college kids back. And the net result was that the 3 weeks of bed rest did more damage to their heart, more damage to their functional capacity and loss of muscle than the 30 years of normal living did. So 3 weeks of bed rest, they lost 30% of their VO2 max. There was a reduction in heart size and muscle compliance. There was an increase in sympathetic tone, and their blood vessels became smaller and less compliant. And there was a significant loss of muscle mass. These findings were very similar to what we've seen during COVID when we put patients in quarantine. When I started working in ICU about 40 years ago, when you came into the hospital with a heart attack or had bypass surgery or a heart transplant, you were in bed for weeks and sometimes up to a month. Nowadays, you're up and moving the next day, and the complication rates have been drastically reduced because of early mobilization. This makes a compelling case that cardiorespiratory fitness and physical activity should be a vital sign. The heart, when placed in bed rest, can lose between 1 to 3% of its muscle mass per week. So how low can we go? And we've learned this from people with spinal cord injuries. 12 weeks of bed rest in these spinal cord injury patients, they've lost up to 25% of their cardiac tissue. So this is something I explained a little bit earlier. So cardiac compliance or diastology is the way that you look at it is being the heart need to act as a rubber band. The compliance or ability of the heart to stretch and accommodate blood, not just of the heart, but of the blood vessels, is a marker of health of the cardiovascular system. So what are some of the things that accelerate the non-compliance of the heart? And this is inactivity, diabetes, hemoglobin A1C. Does anybody know what hemoglobin A1C represents? So we use that as a marker for diabetes, but in chemistry class we call it the Meola reaction. It's how sugar binds with protein, and it's actually how fast people age. When you have a really high hemoglobin A1C, sugar is binding to protein at a rapid pace, and it actually accelerates aging. So, but it's also how the cells age and how your body is aging. You can pretty much look at somebody when you see age spots on people. That's the Meola reaction. That's how sugar is binding with your skin. A lot of diabetics, you can look at the back of their neck and their armpits and see darkened areas there. Some other factors that have to do a lot with the cardiac compliance is coronary heart disease, valvular heart disease, hypertension, alcohol, infiltrative diseases like amyloid and sarcoid, and obesity. Most people think of obesity as being some cosmetic thing, but especially truncal obesity affects every single organ of the body. Truncal obesity, the cells are very active and reduces a guy's testosterone quite a bit because the obesity makes the fat cells produce something called aromatase, which lowers their testosterone. That's why you see a lot of overweight guys develop man boobs, because they're producing estrogen. But more importantly, it produces something called inflammatory cytokines, which penetrates all the muscles, including the heart muscle, and it causes non-compliance of those vessels. So the question is, I gave you all the bad news, so what's the good news? So are these changes to the heart, are they reversible? So this gentleman down in Texas, his name is Kenneth Cooper. He does a lot with exercise and exercise tolerance in patients. And so he took these people, and his first study, he took a group of people between the ages of 50 and 70, and he measured their VO2 max, heart size and compliance, blood pressure, and lean body mass. And they trained them at a relatively low level, 60% of their age-predicted max heart rate. And he did that for 3 weeks, or 3 times a week, for 6 months. And the results showed some improvement in their VO2 max, some reduction in their systolic blood pressure of 5 to 7 points. And the average patient lost about 5 pounds, so some decent results. But he was really disappointed. The group was disappointed because there was really no improvement in the heart size or compliance. So then he thought, well, maybe we just didn't work them hard enough, and maybe we didn't give it enough time. So he took this group and he studied these people for over 2 years. And what he did was he increased the intensity. He brought the intensity up to 70% of their age-predicted max heart rate. He increased the number of sessions per week to 4 to 5 sessions per week. And then he added in a HIIT training interval where they worked them really hard, 90% of their age-predicted max. He did something called the Norwegian 4x4. So they would work really hard for 4 minutes, rest for 4 minutes, and they repeated that 4 times. So he looked at these people 2 years later, and he found a great improvement not only in their functional capacity, but the most important thing is their compliance of their heart looked like they were 30 years younger. So that he was able to restore the compliance of their heart. So to answer your question, yeah, these markers are reversible. Now, these people weren't cardiac patients. They were typically healthy. Some of them had high blood pressure, some had high cholesterol, but overall, they didn't have heart attacks or strokes or anything like that. But I do think this is applicable to everybody if we work hard enough. What came out of this study was you hear a lot now about patients with POTS, and these findings from the study are very applicable to POTS patients. POTS patients have smaller than normal heart size, they have high sympathetic tone, they have dysfunction of their varoflex reflex where they stand up and their blood pressure drops down. And so this type of training has become the standard for treating POTS patients. So I talk a lot about autonomic nervous system, what that means. So the autonomic nervous system regulates those systems of the body that we don't have to think about, like your heartbeat, your breathing rate, those type of things. So you have a brake known as the parasympathetic nervous system, also known as rest and digest, and then you have an accelerator, which is the sympathetic nervous system, which is fight or flight. During exercise, you're taking the foot off the brake, you withdraw the vagus nerve, and this comes from a signal from your skeletal muscle. Chronic exercise changes the balance in the autonomic nervous system to be more parasympathetic dominant. These chronic exercises leads to lower heart rate by increasing parasympathetic tone. So what's the difference between strength training and cardio as far as response to the body? Strength training is not a replacement for cardio, no matter how high your heart rate gets when you're doing the strength training. Resistance training can increase your pulse rate, but the mechanisms behind the increases are fundamentally different from those from aerobic exercise, and so are the benefits. During resistance training, you rely on the central nervous system stimulation to spike your heart rate, whereas aerobic exercise demands cardiovascular adaptations like improved heart function and blood vessel health. Heavy resistance training can also be very dangerous to raise your blood pressure. In short, skipping cardio leaves a critical gap in your fitness level. A normal blood pressure is listed as being as close as possible as 120 over 80. Getting your blood pressure as close to 120 over 80 is critical in maintaining cardiovascular health. Blood pressure is determined in part by the amount of resistance in our blood vessels. During exercise, the muscles release metabolites that cause our blood vessels to dilate, lowering the vascular resistance. Sustained endurance activities are the most potent ways to induce a dilation and therefore are optimal for lowering your blood pressure. I'd like to be the first to admit that providers often measure blood pressure incorrectly. Proper technique for measuring your blood pressure means that you're sitting still in a quiet environment for at least 5 minutes. Ensuring that the arm is at the position of the heart, using a proper fitted cuff, making sure the cuff is not too big or too large. Make sure that you have an empty bladder when you're taking your blood pressure. If your bladder's full and you have to have some urgency, it can raise your blood pressure by as much as 10 points. And making sure both feet are on the floor. Once a year, I recommend my patients monitor their blood pressure twice a day for at least 5 days and bring those numbers back to me so we can see if their blood pressure medications need to be regulated. We all hear that sodium, reducing sodium in processed food is very important for reducing blood pressure. This is very as we get a little bit older, you have to understand that your kidneys are getting older with you. And as we get a little bit older, most of us are very sensitive to sodium. And so how sodium plays a role is your body has something called serum osmolarity. It's the thickness of your blood, right? And so it always tries to regulate the thickness of your blood. And so when you consume sodium, your body, that thickness is going to get a little thicker, and so the body's going to compensate and it's going to hold on to water. Where you're just one big column of water. So the more that fluid that you have in the column, the higher your blood pressure is going to be. So the way God made us is water follows sodium. So again, the more sodium that you're taking in, the more that water that you're going to hold. Does that make sense? So regular cardiac exercise puts gentle stress on your blood vessels. And it's just like, think of your blood vessels as being like a garden hose. And if you constantly use your garden hose is going to stay nice and compliant. That's what exercise does, having a nice compliant garden hose. But if you don't use that garden hose, you leave it out, it's going to get nice and stiff. Okay, that's a guy that doesn't exercise. And so the thicker that garden hose is, the more narrow that garden hose is, the more turbulent the flow through that, and the higher your blood pressure is going to be. So get out and use those garden hoses. So getting enough fiber is very important. Vitamin D plays a very critical role in blood pressure control. Vitamin D controls your parathyroid. And so by governing your parathyroid, it also helps reduce your blood pressure. Potassium and magnesium also play a critical role in your blood pressure. But make sure you check with your doctor before you add potassium or magnesium. And there are different kinds of magnesium, but each type of magnesium plays a different role. The most common types of magnesium that you see, like in the drugstores, are magnesium oxide and magnesium citrate. They're poorly absorbed and they cause an osmotic effect. They're really for people with constipation. That's why they're so common. But there's other magnesiums out there, and it really like if you have if our muscles are stiff from overdoing it, magnesium melanate is the type of magnesium to get. It's very well absorbed. There's magnesium glycinate, which I prefer. Magnesium glycinate gets fully absorbed. The glycinate portion actually helps people sleep. The glycinate helps with neurotransmission, with sleep. The glycinate will actually, one of the things that should happen during sleep is your body should naturally cool down. The glycinate will help you do that. So it helps people that tend to wake up and they can't get back to sleep. The glycinate will help you keep asleep or get back to sleep easier. So eliminating alcohol will also help your blood pressure. Reducing caffeine will help your blood pressure. Believe it or not, we have a caffeine gene in us, and we're all different. Some people, they walk by the coffee pot and smell the caffeine and they'll get palpitations. Well, other people that, they can drink coffee before they go to bed and it really has no effect. It depends whether you're a fast or slow metabolizer of caffeine. And again, it depends on our genetics. Stop smoking, of course, and optimization of sleep. Another condition that's very common, and I never realized how common it was until I got to Ashtabula, is atrial fibrillation. So this is very common, especially in the older population. The prevalence of atrial fibrillation in people over the age of 80 is somewhere between 30 and 35%. This is caused by the heart develops abnormal pacemaker cells. And these pacemaker cells, typically 75% of them are actually outside the heart in the pulmonary veins. Some common symptoms of atrial fibrillation. In the first one, some people just walk in the office and they've just been fatigued for a long period of time, and we do the initial EKG and we find that they've been in AFib for a while. But oftentimes they're complaining of irregular or rapid heartbeat, palpitations, weakness and fatigue, shortness of breath, dizziness or lightheadedness, and swelling of either their trunk or their lower extremities. Common causes of atrial fibrillation, Atrial fibrillation can be genetic. It can be caused by sleep apnea, obesity, hypertension, having a heart attack, heart valve disease, high blood pressure. The typical younger person that comes in, less than 60, is typically a guy with obstructive sleep apnea, with hypertension. We see those quite often through our doors. For treatment of atrial fibrillation, there's really three mainstays of treatment with atrial fibrillation. One is people get too sick if they go too fast or too slow, so we want to try to control their rate. Two is we want to try to restore atrial fibrillation. We know people have a better quality of life and actually live longer if they're in sinus rhythm. And third, and the most important factor when dealing with atrial fibrillation is stroke prevention. Strokes due to atrial fibrillation tend to be really bad. We're very fortunate in Ashtabula that we have Dr. Kanj from the Cleveland Clinic that comes to Ashtabula the second Tuesday of every month. Dr. Kanj has been a friend of mine for over 20 years. He's one of the first that have done, one of the first in the country have done Watchman techniques, which is a way of guarding against strokes due to atrial fibrillation. And he's been doing ablation techniques for atrial fibrillation and ventricular tachycardia now for over 20 years. Any questions about atrial fibrillation? So I want to talk a little bit about diet. I guess anybody that knows me knows I like to talk about diet. So I'm always asked what I feel is the best diet. And as I said before, I said there's over 4,000 diet books on Amazon, so not everybody could be an expert. But I mean, to be non-dogmatic about diets, I mean, you have to answer three questions. One is, are you overnourished or undernourished? Two, are you under muscled or over muscled? And then three, how metabolically healthy are you? When we talk about metabolic health, we look at somebody's waist circumference, their blood pressure, their liver enzymes, triglycerides, and HDL. The biggest changes to the American diet over the last 40 years has been the elimination of animal products. We eat far less animal products than our European counterparts. We're encouraged to eat grains by the food industry mainly because of the profit margin. The profit margin on a barrel of grain is at least eightfold. The average barrel of grain, on average, is about $6. From that barrel of grain, you can produce nearly 80 boxes of Wheaties. Our reliance on grains has led Americans to consume nearly over 400 calories compared to 40 years ago. The number one food in America is, anybody know? Pizza. Yeah. What's the number one vegetable that we consume? Anybody know? Potatoes, in the form of French fries. Overall, overall, our consumption of red meat is down 60% over a 40-year period of time. So, what is higher in fat? We're all red meat, eggs, or salmon. Anybody know? Salmon. We're always told to eat salmon, right? We always told them how good that is for us. Salmon is 20% fat. Eggs are 18% fat. Red meat is 13%. So, has anybody heard of the hallmarks of aging? Anybody into aging? So, there's actually a part of the NIH that studies aging, and they came up with 14 reasons right now. There used to be 10, and they added 4 last year, and they're called the hallmarks of aging. But there's one that is very malleable in the fact that it's something that we can, if we're conscious, we can reverse. So it's called decreased nutrient sensing. So as we age, there's a couple things that happen that cause decreased nutrient sensing. One is we all produce less gastric acid as we age. Our belly produces less gastric acid. A lot of people think that GERDs when people get gastric reflux, people think that their body's overproducing. In most cases, they're underproducing gastric acid. So how that plays a role is gastric acid is it's essential for the absorption of nutrients. It's the first step of protein metabolism, breaking down protein. It's essential for the absorption of B12. It's very essential for the absorption of selenium and chromium. The other thing that happens as we age that makes decreased nutrient sensing is as we age, a lot of times our our leg circumference will stay the same, but when serial CAT scans will show, what happens is there's increased fat deposition in the muscle. And so why that plays a role is the more fat that you have in your muscle, the less sensitive you are to insulin. And so if you become insulin resistant, insulin is a growth, it's a growth molecule. And so then your body cannot absorb the protein and sugar into that muscle. And so you have less growth stimulus there. So the current recommendations for protein is 0.8 grams per kilogram of body weight. And what I've noticed in the time that I've been in Ashtabula dealing with elderly patients seem to me that they lose their taste for protein, which is exactly what shouldn't happen as we age. We should be eating more protein. So if you get nothing else from this talk today, I want you to walk away knowing that not all protein is the same. So each protein is scored by a PDC-AAS, or Protein Digestible Corrected Amino Acid Score. And it measures protein quality based on the amino acid composition and digestibility. Animal protein scores are the highest. Milk and eggs are complete protein and are essential amino acids. Chicken and beef are slightly lower with a score of 0.95. The best plant source of amino acids is soy. Pea protein scores at 0.85. Tofu is a good source of protein, but it's low in leucine. Leucine is the key amino acid for muscle growth. Whey protein isolate has the highest score for muscle growth. So tips on achieving optimal weight as we age. And it's not by getting Ozempic. So the key is not trying to find one magic solution. Focus on stacking small evidence-based changes. Remember, your metabolism is not fast or slow. It is responding to your daily choices in sleep, nutrition, activity, and muscle mass. Focus on these factors consistently and you will create a lasting metabolic health. Here's how it works. Your total daily energy expenditure has 4 components to it. It has the exercise component, which can be somewhere between 0 if you do no exercise, and if you exercise long and hard, it can be up to 30%. Non-exercising activities, like doing daily activities of daily living, parking your car farther from the store, can be somewhere between 5 and 30% of your calories. Do you know that the food that you eat dictates your metabolism? It's called the thermal effect of food. Have you ever heard that before? So some foods will raise your metabolism. We'll talk about that in a little bit. But eating protein will increase the direct effect of food. So like if you took your temperature before you ate a steak and then after you ate a steak, your core temperature would actually go up a couple degrees. Your body doesn't like converting protein to glucose. It's called gluconeogenesis. And it actually takes the body an extra couple steps to try to do that. And in doing so, you're actually burning some calories. So when you hear about high protein diets, the key for that is one is you're increasing the thermal direct of food, but you're also, by eating more protein is the most satisfying so that you're not constantly being hungry in between meals. And then your resting metabolic rate accounts for somewhere between 40 and 80%. So a deep dive in the research on your metabolism told me that you can't actually speed up your metabolism. It's like saying that you can make your car drive faster when it's in park. What you can do, though, is influence how many miles your metabolism can drive each day. So some combining strategies for weight loss. So what I ask my patients to do is to try to burn an extra 200 calories per day. And I think everybody can find some way of exercising. I have elderly ladies that actually bought those little machines that their feet slide back and forth. And by doing that after they eat their meals, they notice that their blood sugar goes lower and their needs for insulin went down quite dramatically. But those things actually, things work as long as you use them. like your treadmills at home. So the biggest mistake people make in dieting is they try to drop their calories too quickly. And this can lead to weight loss initially, but what you're doing with it, you're jeopardizing losing muscle. As we lose muscle, we lose our metabolism. The other problem with this is as we lose muscle, we lose places to store glucose. So one of the common things that I've been seeing is putting elderly patients on these GLP-1 agonists like Ozempic and Journal. And they do a nice job, but if people don't do things to maintain their muscle mass on these drugs, what happens is they lose a disproportionate amount of muscle mass compared to fat mass. And in doing so, again, you're ruining your metabolism. And then they start telling me, after they lost 40 pounds, that their blood sugar is starting to creep up. Well, when you consume food, your body's always going to produce sugar from that food because your brain controls everything, and so the body knows that the brain wants sugar, and so you produce sugar from the food. And if you're not moving, you're not doing anything, 80% of that sugar should be parked in your muscle. But if you don't have those stores, then that sugar is going to start showing up in your blood. So sleep plays a huge role in our metabolic health. Most people think of sleep apnea is lack of sleep. It has nothing really to do with lack of sleep. What it has to do with the lack of not breathing properly. When you don't breathe properly, the purpose of a breath is to provide oxygen and blow off carbon dioxide. And when you don't breathe properly, you have high levels of carbon dioxide and low levels of oxygen. The problem with that is that puts your body under stress. And when your body's under stress, you're going to have high levels of cortisol, you're going to have high levels of insulin. And when you have high levels of cortisol and insulin, what happens is those hormones are what we call your fat storage hormones. And so having high levels of those do not allow your body to use fat as fuel. And your body's reliant on glucose, so you're never tapping into your fat stores. So some of the recommendations I have for people to improve their sleep. Sleep is dependent on 3 factors. Having high levels of adenosine. Adenosine is the product our body produces in conjunction to the amount of work that we do during the day. So you put in a good day's of work and you feel with fatigue, that's adenosine. By drinking caffeine, it suppresses the effects of adenosine. So you want to avoid drinking caffeine at least 12 hours, at least 8 hours before you go to bed. The other thing that you want is you want to have high levels of melatonin. And one of the ways that our body produces melatonin is in conjunction with our circadian rhythm. So if you're exposed to morning sunshine, your body knows what time of the day it is. So by seeing morning sunshine, it's going to suppress cortisol. And it's going to suppress cortisol, and it's going to tell your body when to start producing melatonin closer to your sleep cycle. So the other thing that I recommend is that you try to go to bed roughly around the same time every day. Try to limit pre-bed stimulation. Optimize your sleep environment, cold and dark. Try to regulate food and alcohol prior to bed. Try not to eat at least 2 hours before you go to bed. And try not to drink alcohol at least 3 hours before you go to bed. Try to avoid caffeine for at least 8 hours. And then optimize your circadian rhythm. Do you know that fish oil has a beneficial effect in your metabolism? You hear a lot about fish oil. You go to one doctor, they tell you to take fish oil. You go to another doctor, they tell you not to take fish oil. The documentation for fish oil, there's studies for fish oil as far as cardiovascular health, there's pros and cons. But when I look at taking a supplement, I look at the benefits versus the risk. I also look at the cost, like everybody else. So fish oil is pretty cheap. And what fish oil can actually do is reduce your triglycerides, the amount of fat in your blood, by somewhere between 20 and 30%. It's actually one of the few things, along with exercise, that can raise your good cholesterol, your HDL cholesterol. But 3 grams per day can actually increase your resting metabolic rate by 14%. It also increases fat oxidation. Fat oxidation is your body's ability to utilize fat as fuel. Fish oil needs to be taken with food for it to be absorbed. And if your fish oil has any taste or smell to it, it's rancid. It should not have any taste or smell to it. So some other little tricks to raise your metabolism. One is by eating spicy foods. Peppers, ginger, chilies. They can increase your metabolic rate by 3 to 5%, and the effects last 1 to 2 hours. Cold exposure, which we had a lot of this winter. By lowering your room temperature a few degrees, what you do is you actually like micro shiver. And by micro shivering, you're actually increasing your basal metabolic rate, and it can have increase your metabolism. Caffeine can increase your resting metabolic rate by 3 to 11%. And this lasts 1 to 4 hours. If you take caffeine before you exercise, it can actually increase your fat oxidation. And lastly, green tea can increase your resting metabolic rate from 4 to 5%, which lasts 1 to 4 hours. Anybody heard of green tea, yerba mate? yerba mate? So yerba mate is a green tea. I actually learned about yerba mate about 10 years ago. I had a patient big, huge guy from down south. He came back and he in a 3-month period of time, he was down like 30 pounds. I said, what happened? He goes, I had a neighbor move in from China and I helped her clean up her yard and she gave me 2 big bags of tea. And she told me to drink 4 cups a day. And he goes, I don't know what happened, but I lost 30 pounds. I said, well, next time you come back, bring that tea. And so he showed me it was yerba mate. So, but, I mean, there is a lot of research actually on it. And yerba mate tea actually stimulates, when your body eats, it actually produces GLP-1, which is the active ingredient of Ozempic, Trulicity, and Mounjaro. And what it does is it stimulates the pancreas to produce insulin. It's one of the first steps of metabolism. And what this yerba mate tea does is helps your body produce more of the GLP-1. So it's a natural way of your body producing this, which will aid in weight loss. All right, so everybody should know three things, okay? To prevent cardiovascular disease, you need to know 3 things. You need to know what your bad cholesterol is. You need to know what your LDL cholesterol is, right? You need to know what your blood pressure is. And then you need to know what your BMI is. Your exercise target, if you're able to, should be 45 minutes of cardio per week, or 45 minutes of cardio 4 to 5 times per week of moderate activity. And so what I want, I talked about between 70 and 75% of their age predicted max heart rate. An easy way of doing that is when you're exercising, you should always be able to carry on a conversation. But you want to be working at a level where if you were exercising next to somebody, that you would rather listen than speak. So but you could talk if you wanted to, but you couldn't sing. So you can walk and you can talk, but you couldn't sing. Okay? So that should be your exercise intensity. And then if you're able to, I want you to try to push yourself. I mean, again, if your doctor says it's okay and your joints say it's okay, I want you to try to push yourself a little harder than normal, just 1 time a week. The way that you think of your fitness level, you should think of it as being like a pyramid. You want a nice wide base of what we call zone 2, that moderate type of exercise. But then you want a high peak. And again, you don't really need to do that too often. 1 time a week is just sufficient to maintain the peak of your exercise tolerance. So exercise is one of the most common areas where people struggle. Exercise requires dedicated time each day. The goal is to find unused time that can be repurposed for exercise. The best indicator of these include strength metrics, cardio performance, mobility and flexibility, body composition, and blood markers that reflect overall metabolic health.